Welcome everybody to the break. Today we're going to be discussing the process of reopening. This is going to be more of a macro look at what the states in the Northeast are doing to open up as we now turn to that phase. We will be having another break coming up, looking more at the micro of what insurance agencies should be doing to reopen to ensure the safety of their employees and customers as well, so stay tuned for that. I'm Brad Lachut. I'm the Director of Government Affairs for PI Northeast. It's Clare Irvine. So, hi, Clare.
Hi.
And Clare will be taking us through this process of reopening, which is what we're getting a lot of questions on now, understandably, since all the states are now kind of shifting and putting their plans out. So with that, Clare, please take it away.
Okay, as Brad said, I'm Clare Irvine. I'm the Government Affairs Counsel for PIA, and today we'll be talking about what exactly the reopening process is going to be looking like. So we're going to start with the metrics that the states are looking at for how they're going to decide when to reopen, the phases that they are reopening in. They're not just going to flip a switch and reopen everything. And then more specifically, what it means for insurance agencies. So first of all, we'll just get into the metrics. These are the specific metrics that Governor Cuomo in New York has put out, but they're generally the same that all the regional governors are looking at. So they first are looking at the hospitalizations, so that there's a decline in total hospitalizations as well as a decline in deaths, and whether there are new hospitalizations and hospital bed capacity as well as ICU bed capacity. So they're really looking at how the healthcare system's ability to respond if there are, as the outbreak continues, so that they're not going to get overwhelmed again. From there, they're also looking at the diagnostic testing capacity and contact tracing capacity. So both how many people can be tested and the ability to trace their contacts due to how highly contagious this disease is. So for currently, a number of regions of New York have hit all these 7, and for the capital region and Western New York, they're just increasing their contact tracing capacity, and then they'll be able to start the reopening process. And while it's not quite as specific in states like New Jersey and Connecticut, they're looking at the exact same, generally the same metrics to figure out when they have reduced the number of hospitalizations, reduced the spread of the illness, and to quote Andrew Cuomo from pretty much every press conference, what steps they've taken to flatten the curve or stop the spread. So once they've stopped or greatly reduced the spread and increased testing capacity, there will be a phased reopening. So essential businesses and essential business activities are still permitted to operate. So if your business has been operating for the last 2 months because you're essential, you don't have to suddenly stop operating because you're technically in phase 2. That's for when the restrictions start to be lifted. The phases also apply to non-essential businesses and business activities and when they can resume. And there's different degrees of details that have been released for each state, including different degrees for each phase. So New York has laid out very detailed phases, but they go into more detail for phase 1, which has been starting up. Other states are focused really on what stage 1 will look like, and they're going to release more details as we go on. So you'll see that as we start getting into what each phase looks like, it's based on New York, and we've included information for other states based on what's been released. And I will add that all the information for each state is linked below in the video. So if you want to look at your state-specific plan, I recommend clicking the link. They go into various details, and I'm sure those links will be updated as more information gets released. So to start with, phase 1 is one of the big ones will be resuming non-essential construction. Essential construction has been able to continue throughout the emergency orders and all the restrictions, but non-essential construction can resume once phase 1 begins. Unlimited retail operations will also be allowed. That's primarily pickup and drop off in New York and New Jersey, and retail operations at 50% capacity with restrictions and requirements such as mandatory hand sanitizer and PPE requirements for employees, and the continued wearing of face masks and facial barriers when social distancing is not permitted. For Connecticut, restaurants, museums, and zoos may start reopening for their outdoor operations, and offices may open at 50% capacity. although they are encouraged to continue working from home. That begins on May 20th. New York will allow manufacturing to start resuming, as well as wholesale trade, agricultural, forestry, fishing, and hunting. There's further information about the requirements for each of those industries in the link below, as well as recommendations to continue to keep employees safe, as well as customers. New Jersey is also allowing limited car gatherings, which are like drive-in movie theaters, or if you want to host a kid's graduation party, I guess, from cars, you can click below to look for more information, but it's kind of starting to let people start to see one another again. And so if phase one is successful and the curve remains flat, doesn't start to increase, and the metrics, the region continues to hit the metrics based on healthcare and testing and contact tracing, then after they will be able to implement phase two. And that's where professional services, including insurance agencies, can start seeing the restrictions on operations lifted. There'll also be further restrictions on retail will be lifted, as well as administrative supports that operations can resume. Because this is still several weeks ahead of us, there aren't as many details available for phase two in New York, but those details will surely be forthcoming as regions start to reach this phase. Additionally, New Jersey will allow expanded retail, safeguarded restaurants with outdoor seating, as well as limited personal care. The real estate and rental and leasing can start resuming, so people can start buying houses or moving if that's something they want to still do at this time. Connecticut has had a slight issue with their hair salons. If you're in Connecticut, I'm sure you've seen it in the news. They were originally part of phase one, but they've now been pushed back to June 1st or phase two and coordinated with Rhode Island. And Vermont has included farmers markets in phase two. So that's a big one, particularly in a state that has a lot of agriculture and that's not going to have as much tourism in the coming weeks. And then still, as long as the region continues hitting the metrics, phase three, they will start hitting phase three. For New York, phase three will include restaurants and food services. There really has not been details about what that will look like, and if they'll be looking at what New Jersey and Connecticut have been doing in terms of primarily outdoor seating, restrictions on the indoor capacity. So expect information about that when that phase comes. And it's not going to hit no region will probably hit phase three for at least a month. So there's still a little time to figure out the details on that. New Jersey will also include expanded dining options, personal care, and bars with limited capacity as part of phase three. But again, they're just starting phase one this week, so that's still at least a month in the future. And then much longer, probably no sooner than July, there'll be phase four in New York, which is the arts, entertainment, recreation, and education. So if you've been home with your elementary school students, this is the one you're probably paying closest attention to. Education is probably not going to be reopening this year, but it is part of the plan. All of this will come far, far in the future as the states and the governors pay close attention to the metrics that we talked about at the beginning and make sure that the regions are hitting those metrics to get to phase four. So hopefully, fingers crossed, phase four is definitely, we've reached phase four by the next school year. Just a couple additional reopenings. Our drive-in movie theaters and golf courses were reopened separately from the phases. That went into effect May 15th. And beaches are reopening at 50% capacity for Memorial Day, and that's a regional effort. So if you want to go to the beach for Memorial Day, probably get there at dawn because there's not nearly the same capacity, but it's increasing the outdoor space available to people throughout the region. And now, since I'm guessing everyone watching this video is an insurance agency or a similar business.
Or my mom.
What?
Or my mom.
The big one is insurance agencies have been in most of our states considered essential businesses. And even in the states where they're not necessarily essential retail business, they are allowed to have at least limited operations under emergency restrictions. So those restrictions will remain in place till they reach the phase of the reopening, which is for at least New York and New Jersey phase two. And for Connecticut, it's the 50% office. I'm guessing it's 50%. It's part of the 50% office reopening this week, where you start increasing number of people in your office, but with pretty strict restrictions on the workplace management. As those reopenings hit, so there's no restrictions on operations. Once you can start reopening, there will be requirements or strongly encouraged steps to take to prevent the spread of COVID-19 within the workplace. We'll be, as Brad said at the beginning, we'll be having another video on what to do in your office as you start reopening. So stay tuned for that. It's the big thing right now is that you don't have to shift your operations if you've been open, because you're not considered phase one. You won't see the restrictions lifted until your phase of the reopening hits. So if all of your workers have been working from home, they can't come back until phase two. So just a quick, I know this was a lot of information, so just a quick summary of state by state is Connecticut's phase reopening starts on May 20th. That does include outdoor seating at restaurants. New Hampshire is actually ahead of everyone. They weren't hit quite as bad as New York or the tri-state area. They've reached phase 3 of their reopening plan. New Jersey's reopening went into effect this week. New York is based on regions. So a number of regions have started phase 1. Capital Region, Western New York, or just have to hire contact tracing, increase their contact tracing capacity, and then they'll hit phase 1. New York City is still far behind, but I'm sure you've seen that from the news. And Vermont's phase reopening starts this week, but they have very strict restrictions on out-of-state visitors. So any New Yorker hearing this wanting to go visit Vermont, they'll at least attempt to require you to quarantine for 2 weeks. And so if you have further questions, please email myself, Brad, or the PI Resource Center. Again, we'll have another video on what steps your office specifically can take as you start preparing to reopen. So, because I'm sure many of you are really eager to return to the office, and we'll continue to post further information. And again, there's links to each state-specific plan for reopening, at least as of today, May 19th. So you can check those out for further state-specific information. And some of the states, particularly New York, have some really great resources, including for New York, one tool that allows you to look specifically at your industry in your county on this day to see what operations are allowed. So I'd highly recommend checking those out for some more very specific information, very specific details.
Thank you, Claire. So I just have one comment here before we close, and it's interesting reading the guidance from all these different states. It seems one of the recurring themes is the new normal. I think people are saying, "Oh, what are we going to get back to normal?" And I'm not sure if there is such a thing. Even in phase 4, there's still some understanding that people are still going to have to be required to do social distancing and probably wear masks in public. I would think almost certainly. You've mentioned a couple times reducing capacity within businesses. So that's something that I think is here to stay for a while, perhaps until we have a vaccine or some other, perhaps maybe more testing. So that seems to be, again, that might be phase 4, but I don't expect a return to normal even past phase 4 for a while.
Yeah, and I think some of the steps, particularly for workplace management, are probably going to be on the books until the pandemic is out, kind of falls far behind us, because some of them are steps we probably should have been taking in the first place. For terms of cleanliness, like air circulation, readily available hand sanitizer, and not cramming people into workplaces like sardines. Because I know we've talked, it's not just COVID, it's in the winter, that's how everyone gets everyone in your office suddenly has the same cold.
Exactly.
So it's just now we have more reason to take those into consideration. I doubt face masks are going anywhere, but you can now, even Disney, you can get Baby Yoda face masks.
Got mine in order, yeah.
I'm pretending to be shocked by that.
The other thing to note is for those in New York, obviously New York is a big state, right? So New York almost has like 2 layers of reopening versus the other states that seem to be going with one, right? New York has the regions, and also within the regions, different phases going on. where the other states seem to be just going with a phase approach. And I think that probably is largely due to the size of New York and perhaps the scope of the problem too, versus the other states.
Yeah, I think that's an important note because the pandemic has hit New York in the regions of New York very differently.
Mhm.
And also just the density of how people live in New York City compared to how people live in like New Hampshire is drastically different and has a huge effect on how the virus is spread.
It's a really good point. Something to keep in mind for those of us who live in more populated areas. It's the price we pay, I guess.
Yeah, invest in some fun face masks. We're going to be wearing them for a while.
All right, anything else, Claire?
Nope. Just stay tuned for our next video about what to do in your actual workplace and for more specifics.
All right. Well, thank you, Claire, and thank you everybody for joining us, and we'll talk soon.